Hello and welcome to Fortis. Yes. Right. I heard that you're a doctor and now you then started your own company. Oh, you are helping patients in Burma.
Yeah.
Nice. So let me introduce first. I'm Dr. Mandhani. I'm Executive Director in the Department of Renal Sciences. So I'm basically a surgeon who deals with urological problems. So urological system is a beautiful system which we people don't talk about. So mainly it consists of kidneys, ureter, bladder, prostate, and genital organ. So you see, I was in a teaching hospital. I was a professor. I retired as a professor. So I worked in the teaching hospital for almost 25 years. And I'm with Fortis for the last 6 years. And we do a lot of robotic surgeries, and we deal with a lot of complex surgeries also. Like if you start with kidneys. So kidneys, initially we used to remove the whole kidney if kidney has a small tumor. Now it's possible to remove the tumor and save kidney with the help of robotic surgery.
So could you please share me the important benefits of the robotic surgery than others?
See, I've seen a misconception among common people. They think that robotic surgery is done by robot, which is not true.
Yes.
So it is an extended form of laparoscopic surgery. Laparoscopic surgery is keyhole surgery, where you create holes and put instruments and do the surgery. So robotic surgery is an advanced version of laparoscopic surgery, where the magnification is good and vision is good, it's 3D vision, and the instruments are having more movements at the tip. So it seems like you're putting your hands inside the abdomen and doing the surgery. So precision is better, time is little less than laparoscopic surgery, and outcomes are better. But this robotic surgery is not good for all kind of indications. Like what we do mostly, as I said, for small kidney tumor, where we have to save the kidney and just remove the tumor. And the most common form of indication is prostate cancer. So you see, this cancer develops in male after the age of 55. So once they have localized prostate cancer, so we remove the complete prostate with the help of robot. Now the interesting part is when we remove the prostate, so it comes with a significant side effect, that is sexual impotency, because the erection nerves, they travel by the side of the prostate. So when you remove the prostate, most of the men, they lose potency. So we have a very beautiful remedy for that. So we have a state-of-art implant surgery where a male can regain his sexual power. So it's a complete, comprehensive management strategy which we provide for this with honesty. That is one, and second important part we deal with is bladder cancer. So any person who has blood in urine, he should be serious about going to the urologist and having a consultation, because if you're a smoker and you have blood in urine, you can have bladder cancer.
Yes.
So for that also, like once you get your bladder removed, then how will you pee? So we make new bladder with the help of intestine if patient is suitable, and making a new bladder and fixing it to the urethra so that patients can pass urine on their own. So that surgery can also be done with the help of robot.
Yes.
So it's a complex surgery. So wherever we need a complex situation or complex surgery, there is the role of robotic approach, which helps.
Yes.
Yeah, so that is the main advantage of robotic approach.
Oh, okay. Yes. As you said previously, there is the treatment for the impotency. Patient with the impotency can have the implant surgery. Could you please share about this? Because we already refer this kind of patients to you, and you already give the treatment for him.
Yeah.
And now she is quite good, and she already came back to Myanmar
Okay.
today. Yes.
Good.
Yes.
I'm happy to know that.
Yes.
So you see, this surgery is done by using an implant which has 3 components, 2 cylinders which go inside the penis, the male organ,
Okay.
1 reservoir which goes inside the abdomen,
Yes.
and there is a button which is placed in front of the testicle, the ball in scrotum.
Okay.
So, I mean, the beauty of this implant is when you press the button, you get erection, and you can, once you press it again, it goes back to its normal position.
Oh, okay.
Yeah. So that is the advantage of having. We call it 3-piece implant.
Okay.
So there is another kind of implant which is 2-piece, but that is slightly uncomfortable because you have to keep the penis in erect posture and in bending posture. So yeah, it is cheaper, but it is not effective for men. Yeah.
Oh, okay. That's interesting.
And yeah, and I think patients have to stay for 2 nights in the hospital and maybe for a week or so in India, and they can go back.
Yes. Okay. So, may I know which type of renal disease are you performing mostly in India?
So, renal means kidney.
Yes,
So,
yes.
kidney broadly, we have surgical reasons and medical reasons.
Yes.
When kidney fail, we do transplant.
Yes.
So, we are doing transplant, but we just take only related, and we are doing genetic tests to prove that donor is a relative.
Yes.
So once we finish that, then we do offer kidney transplant.
Yes.
For surgical disease, like any form of reconstructive disease, like a lot of children, we have a pediatric urologist also in our team.
Yes.
So children who are having congenital diseases, like congenital disease of kidney where there is a blockage in the drainage of urine from kidney to ureter, our ureters are very dilated, or there is a VUR, vesico-ureteric reflux, or in children, male children, there is a postureuteral valve. So we offer all kind of state-of-art treatment for these conditions. Then in the prostate, when it is not cancerous, then we do have a laser surgery. And for kidney stones, which is a benign problem. So kidney stones, you see nowadays we don't give large cuts. Most of the stones are treated with keyhole surgery, like laparoscopy or robotic. For kidney stones also, if it is more than 2 centimeter size, we do percutaneous nephrolithotomy. It's called PCNL, where we make a puncture inside the kidney. We go in and break the stone and remove them.
Yes.
But stone is small, then we can go to the kidney from urethra, from below. So we have very beautiful flexible endoscopes. We reach there, and by using laser, we break the stones. So stones can be managed without giving a cut if it is small in size.
Yes.
Yeah, so that is the advantage.
Okay. Yes.
And for female urology, like most of the women, if they have urinary leakage, unfortunately, we see that women, they don't come forward. They are more tolerant.
Yes.
So any kind of urine leak can be treated initially with medicine. If they don't respond, then surgery is the treatment. Yeah. If they have stress incontinence, that means when they're coughing or they're lifting bucket of water, they leak urine.
Yes.
And there is another kind of incontinence, we call it urge incontinence, particularly in diabetic women or women with some neurological problems. So they have to rush to the toilet, and before reaching the toilet, they leak urine.
Yes.
So all kind of urinary leakage, surgical treatment is possible.
Oh, okay.
Yeah.
Okay. I will share this to the patients
Yes,
too.
yes.
Okay. So thank you so much for giving
My
time
pleasure.
to us. Yes.
Yeah,
I will
pleasure
share-
meeting you.
Yes, thank
Yes.
you. I will share this valuable information to my patients too. Yes.
Sure. Thank you. Bye-bye.